President Trump and the First Lady have tested positive for coronavirus.
They are now both in quarantine at the White House. The president tweeted the news, writing, quote, "We will begin our quarantine and recovery process immediately. We will get through this together." In a statement, White House physician Sean Conley says both were doing well. All of these come just hours after the president confirmed to Fox News that one of his closest aides, Hope Hicks, had tested positive for the coronavirus.
She tested positive. And I just went out with a test. I'll see what, because we spent a lot of time, and the First Lady just went out with a test also. So whether we quarantine or whether we have it, I don't know.
Hicks had traveled to several events with the president this week, including the debate on Tuesday and his rally in Minnesota on Wednesday. The president also attended a fundraiser in New Jersey Thursday, reportedly spending time in close contact with a number of supporters. The president's rival, former Vice President Joe Biden, tweeted this morning, quote, "Jill and I send our thoughts to President Trump and First Lady Melania Trump for a swift recovery. We will continue to pray for the health and safety of the president and his family." So what impact will this diagnosis have on his ability to run the country and campaign for re-election?
That's a great question, and we are joined this morning by Dr. Suman Radhakrishna, an infectious disease expert at Dignity Health California. Thank you so much for joining us this morning, Doctor.
Thank you for having me.
All right, so the first question, we know the president and First Lady have tested positive for the virus. Is there cause for any alarm if they don't have symptoms?
If they don't have symptoms, that's a very good sign, and there shouldn't be cause for alarm, but things that they have already started doing, which he has indicated, is quarantine yourself and for at least a minimum period of 10 days, plus no fever to be documented without Tylenol or any medications before they can get out of the quarantine period. Most people get tested after they start having symptoms because we still have a long wait in terms of being able to get tested when you're exposed. And so they are in a situation which we hope every one of us will be in, where we can go and get ourselves tested even if we are asymptomatic in the very near future.
And Doctor, the president is automatically considered high risk because of his age of 74. Can we talk about the other factors that make him high risk and what the plan should be?
People who are over age 65 are at high risk. Anyone who has other medical conditions like hypertension, they are obese, they have anything that can reduce their immune system because they're taking medications, let's say for rheumatoid arthritis, or have cancer and are on chemotherapy. These are individuals who are at risk for developing severe symptoms from COVID. So these individuals are still asked to quarantine at home if they don't have symptoms, but they are asked to check their temperature twice a day, monitor for certain symptoms like cough, shortness of breath, and any symptom that happens, we encourage them to call their doctors to make sure that the doctors can decide if this symptom warrants them to go to the emergency room or can they wait it out at home.
And Doctor, it is obvious that the president and First Lady should quarantine. Should they limit their physical activity?
There isn't much data on that. Usually when my patients call me and say that they have tested positive and no, they don't have symptoms, I tell them to limit their activity in terms of contact with other people, and not do strenuous exercise, but walk around and eat healthy and get lots of rest.
And Doctor, will the first couple be in the clear after quarantining for 2 weeks?
After they have finished the quarantine period, and if they continue to have no symptoms, then they can resume back with all the other precautions, which is social distancing, wearing a mask, because this is a brand new virus. We have to understand that we don't know everything about it. Could somebody with the infection get reinfected? There have been reports of individuals getting reinfected. So when in doubt, be safe and follow all the recommendations that the CDC has put out.
Dr. Suman Radhakrishna, thank you so much for joining us. We appreciate it and good to see you.
Likewise. Thank you for having me.
Thank you so much.